So yes, thank you very much, Mahan, and your colleagues for the kind introduction and invitation to present at today's important symposium. I want to acknowledge that I'm on the land, coming to you from the land of the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. And in particular, I want to pay my respects to Gadigal women who have cared and continue to care for country and community. So the task I've been given by Mahan is to set the research scene in which policy innovation is happening and outline a few of the key themes that you might like to keep in mind as the day progresses. So just to give you a bit of background and context, I, along with my colleagues, Professor Marion Baird and Sydney Calusi, who's in the room with you, we started our work on the reproductive body at work around 2016-17. And this was in response to a large DFAT project on investing in women that Marion and I were working on at that time. And that project was looking at labour laws for gender equality in Southeast Asia, amongst other things. But when we were doing that piece of work, we were looking at labour laws, and we found a number of Southeast Asian countries included national legislation for menstrual leave. This sparked our interest. We'd never heard of this before. We didn't quite know what to think at the time, but it led over the next kind of 12 months to us engaging very closely with the global debate on the issue. And as a way of kind of managing our interest, in 2017, the three of us started what we call the Body at Work project. And this was a way to really organise our emerging research and provide a platform to draw others in to and to share information, research questions and ideas. So as many of you will know, there's now a vibrant and rapidly growing body of research literature on reproductive workplace supports coming from a range of disciplines. So law, political economy, sociology, industrial relations, psychology, as well as new schools of thought within feminist scholarship, including critical menstrual studies, feminist materialism, etc. So we've been in conversation with many of these scholars internationally and locally, and made our own foundational contributions to the literature, drawing on our own disciplines of political economy, industrial relations and law. And there's a few examples here of our publications to date. Because of our research work, we've also been drawn into the global public debate. And as some of you will know, and particularly Mary Crook, who's speaking after me, there is no end to the interest by journalists in this issue. As whenever it comes up, we get the call. Australian journalists, New Zealand journalists, French, Spanish, European journalists. And so we're regularly commenting, but here I've also on the slide listed a couple of some media highlights, particularly those pieces that we've written rather than just responded to. Initial focus, drawing out of that DFAT project, was on menstruation and paid menstrual leave. And that led us to complete our first piece of work, which was a mapping paper on menstrual leave policies, a global mapping of those policies that was published in Comparative Labour Law and Policy Journal in 2021. But as policy has evolved, we have developed our conceptual thinking, and we now have a broad focus on a wide range of reproductive concerns over the life course. So menstruation, fertility treatments, pregnancy loss, menopause, etc. And while we've also broadened our the terrain of the policy interventions, we've also broadened our conceptual and theoretical approach to think about how these policies might be used to better support international conventions around the right to work and other things. So we've kind of taken it into that domain as well. So there's a bit of background and context. But I guess the question that many of our friends and colleagues who don't work in this area ask us is, well, why is this policy domain of so much interest now? Like what's changed? What's going on? Well, as workplace gender equality scholars, we can provide a pretty good answer to that question. The first part of the answer relates to well-known trends in demographic and labour market composition. So women's labour force participation has risen and deepened globally, and especially in Australia since the 1980s. But then we've seen another really big boost since the global financial crisis around 2009. And this means that the conditions of work designed around the notion of an ideal, read male worker, do no longer map neatly onto the needs of a large and growing proportion of the workforce who is primarily female. Alongside that, declining fertility rates and ageing populations then combine to shape women's patterns of employment. So we know from our research that more young women expect and do work across the life course. And in fact, one of the largest, most rapid rises in workforce participation is amongst mature age women in Australia. But we've also seen a change in the sectors that they're employed in. And that are lifting their demand for labour. So the rapidly growing sectors of the highly feminised care sector are really important here. So this links to the second part of the answer, which is around workforce sustainability challenges, particularly in the new human service-led economy. So we've moved from a 20th century economy to a 21st century economy, and the structure of that is quite different in OECD economies, including Australia. And it's based fundamentally around human services. So in many respects, the future of work is in the highly feminised health, education and human services sectors. And these are the sectors that Treasury forecast are going to generate the majority of new jobs in the next few decades. COVID revealed systemic workforce challenges in all of these sectors. So a need for gender-responsive workplace policies that can support workforce sustainability, including those that attract, retain and sustain future workforce, has become really important. And it's in this context that we see research showing that menopause, as one feature of this kind of policy domain, can be linked to early retirement in the health sector and also to associated lost earnings and reduced superannuation that have become key concerns. So, for example, the Australian Institute of Superannuation Trustees in 2022 estimated that menopause could be costing women more than $17 billion per year in lost earnings and superannuation. This is a forecast, it's based on modelling, and we need a lot more robust data on these economic impacts. The reason for increasing interest is around changing attitudes of workers. There are many attitudinal surveys around the world that show young workers are dissatisfied with the status quo in the world of work, and young women in particular are changing their expectations of what work should be, what conditions should be part of the world of work, and the kinds of rewards that they expect to have access to. What's interesting, particularly in the last 5 years, is that the attitudes of mature age women are also beginning to change. And so we see the real lift in interest around menopause that certainly was not there when we started our research. And we found many mature age women, those kind of over 40, were resistant to the menstruation policies, but are now very enthusiastic about menopause. Finally, there's a growing body of research of varying qualities that's starting to evaluate the ways in which menstruation and menopause in particular are linked to gender inequalities at work. So this literature looks at the link between reproductive body and increases in absenteeism, the increase in presenteeism, where you're there but not doing, not able to be productive, the relationship between the reproductive body and stigma, negative stereotypes, and importantly, unfair dismissal and discrimination. And there's a few references there on the slide. So what this research demonstrates is that, firstly, this policy domain, if we particularly think about its beginning around menstrual leave, it's an old idea. It's not a new idea. A few years ago, there was a lot of commentary about, oh, this is just a woke new kind of thing on the, new kid on the block, it'll kind of pass. But our research shows that this is, in fact, attending to the reproductive body in the workplace is an old idea, but it is an idea with renewed contemporary relevance because of those changing demographic and labour market trends and patterns. We also know from the research that there's been a really rapid rise and expansion in policy initiatives globally and within Australia in the past 7 or so years. This has mostly been driven within the private sector, but also by government. So, for example, in this year's Women's Economic Budget Statement, we have a statement by the Federal Treasury that the reproductive body can have an impact on women's long-term economic security and work experience. And of course, unions are getting very involved, and Sydney's going to talk to you more about that later in the morning. So I think one of the kind of conclusions we're coming to in our research is that measures to support the reproductive body at work are now at the frontier of workplace diversity and sustainability efforts. Is this new direction in workplace policy, practice and law a good idea? So I want to finish my comments by outlining the research evidence that shows that we really need to tread quite carefully in this policy domain. There are a lot of exciting opportunities that come with the new policy focus, but there are also a number of challenges and risks that need to be taken very seriously. So to start with the upside, dedicated policies that accommodate the reproductive body at work can normalise and destigmatise menstruation and menopause and the reproductive body in the workplace by educating staff and managers and addressing negative gender stereotypes. So in this way, dedicated policies can have the potential to destabilise the old ideal worker norm and help everybody to acknowledge menstruation and menopause and the reproductive needs of workers as a normal and everyday part of working life. There's also evolving evidence from some employers that these policies, when they're implemented, are linked to increased employer engagement and productivity, alongside improved trust between employees and managers. And in this context, employers argue that there are significant reputational benefits of gender-inclusive practices that will help to attract and retain talent. These policies are also part of a strategy to build the gender diverse and inclusive workplaces that research evidence shows very clearly are linked to improved financial and business outcomes. They also provide an opportunity to improve existing policy design, such as around the inadequacies of existing sick and personal leave frameworks, where all workers have the same leave entitlements, irrespective of their individual needs. And what we see in the literature is where those universal entitlements are applied across a diverse workforce, they can lead to direct forms of discrimination against employees who experience severe menstruation and menopause symptoms. And this is a particular issue for those experiencing endometriosis. So there's some of the opportunities and potential benefits, but what about the challenges and risks? So research demonstrates very clearly that policies to support the reproductive body at work are highly contentious and hotly contested. In our assessment, there are very few Labor policies as controversial, particularly amongst feminist scholars and activists. And these are the very people you might think would be most open to these kind of developments. But they're tested because of a very real risk that they have the potential to reinforce biological stereotypes. That is the belief that women are less capable of paid work than men because of their biology. There's also the concern that these policies will raise the cost of hiring women for employers and therefore could act as a hiring disincentive. But I guess the point I want to make here is that these are the very same arguments we heard when maternity leave, as it was called originally, was originally being rolled out. And as we know, maternity leave has become parental leave, and this is now a mainstream everyday policy. So there might be some change in that space. But researchers also raise concerns about the need for policy to be responsive to the needs of different people in different types of work. So this intersectional lens highlights not only the specific needs of transgender and non-binary people experiencing menstruation and menopause, but also workers across frontline, remote, and desk-based jobs and sectors. So when we bring an intersectional lens to this policy area, we need to think beyond just identity and sexuality, but think about sector and occupation as well as other aspects of our identity. So another important risk to manage, and the one that we can address, particularly as academics, but also in industry and in unions, is the need for more evidence on impact. We have a lot of anecdotal evidence that these policies, where they've been implemented, have been well received, but we need more research evidence on the process of implementation and its impact. And we need to do that research in order to mitigate the risks that I've highlighted and test for optimal design. So at this stage of our research, our hypothesis is that policy design is everything. And it's in the design, as Mary Crooks will elaborate on, that we manage these risks. Policy must not treat menopause and menstruation and other reproductive issues of the body as a uniform experience, or expect all women to experience these things in a similar way. There is enormous heterogeneity of worker experience and workplace. So some employees may require different levels of support or no support at all, and it will vary from sector to sector. Within the policy design, privacy and disclosure is a critical issue to manage. We see in the literature that many people do not want to discuss personal issues of reproductive well-being with managers or with colleagues. So how can policy be designed to also provide access to support for those workers? And as we know, privacy concerns can be particularly important for transgender, gender fluid, and non-binary people who may need additional support for menstruation and menopause, but do not wish to disclose their gender identity at work because of the fear of discrimination. Finally, in terms of the design space, we need impact research that can help us understand what the optimum suite of policies might be. There's a discussion around paid leave. There's a discussion around workplace adjustments and flexibility. There's discussion, and we know on the bargaining table, should sick leave or personal leave just be opened up to these issues, or do we need dedicated identifiable leaves? Then there's, amongst our research community, a discussion about, well, should we get rid of all, the long drop-down list in your HR program and just replace with a life leave or just a common set of a common leave clause? So these are the really important questions and challenges and potential risks that we need to navigate in this domain, in our work, in our research, and in our policy design. So thanks for the opportunity to share some of the research evidence in this space, and do a really excellent day of interesting conversation.